Hello, I'm Dr. Craig Butler, your Northwest Ohio chiropractor, and we got Tim here this morning. He started coming in last week with some low back and disc issues, and Tim's a CrossFitter. He's actually an instructor over in Fremont at JG3 Fitness. So if you've been thinking about getting into CrossFit or looking for a new workout, Tim can get you straightened out on that. So he was having, this is old football injury, right?
Yeah.
So, what, 10 years, 12 years ago?
Yeah, probably longer than that.
Longer than that. He doesn't want to say how old he is. So, and when he was kind of doing some overhead stuff with some squats with weight, right?
Yeah.
And that's when we were starting to get some issues. So, and the main issue is kind of his upper lumbar spine, and it's really starting to loosen up. He hasn't done any squats yet, so we don't know. We're still waiting. We might wait another week or so on that, but just make sure he's ready to go. But we've been adjusting him. I got him doing some Cobras or Mackenzie extension exercises on his own. And at first those were tough and they're getting a little easier. And he's had some muscle spasms on the right, and they're still there a little bit, but they're getting better. So we're going to adjust him here. And we're really going to try and get some good extension in his thoracolumbar junction. So you're going to see I'm going to do things a little different adjustment today for that. So let's have you lay on your back, Tim. Good. We're going to have you scoot about 3 inches. Great. So we really want to create some extension. So I'm going to use the flexion distraction table to get them into extension so we can create that motion at that joint. Cross your arms. There. Good. Lay back. Take a deep breath in. Let it all out. That moves better than last week.
Yeah.
That was good. Good. Try to get one a little higher. Let that air out. Good. Turn on your side.
Easier on your table.
Yeah. Yeah. Starting to move more like your age. Now, Tim's also a nursing student. Used to be a paramedic, right?
Yep.
Yeah. So now he's trying to get that. You get an RN?
RN, yeah.
Nice and easy. Other side. Good. Switch this way. And slide this down. Good. Face down. So this is the easiest Tim's moved so far. He's really improving quite a bit, which I figured he would with how active he is. He probably just overdid it a little bit one day, and that's what I'm here for. Yeah. Good. There, relax. So, now that we got that joint to release and it's moving, we turn the table on to keep some passive motion happening at that joint so the brain can get some feedback from all the proprioceptors that are in that joint about what it's like to move when you're not all jammed up.
Is it normal the first time the table drops? I feel a little
Pressure
pressure
sore.
in my back, and then as it keeps going, it gets looser.
It'll start loosening up, yeah. And I think, because we still have a little bit of that muscle spasm on the right, so I think, your back's kind of still in protect mode a little bit. It's definitely improving. Tim did a lighter workout this weekend. He said running, push-ups, and sit-ups, and he did okay with that. And I think we're going to wait another week or so until he starts. Are you going to try doing some unloaded squats, maybe?
Yeah, I did 300 air squats this week.
Okay, so he's already doing squats without extra load. Trying to convince him to get back a little more paleo on his diet. Said about a year ago he was doing really good on it, and then he moved to Ohio from Florida, and those gray clouds just set in. Right?
Yep.
So we talked about that last time. That muscle's feeling a lot better right now. That's good. Cool. Well, bring it back in the chair. On your way to class, or?
No, just finished up for the day.
Oh,
Like early morning.
early.
Yeah.
Yeah, that feels great right now. Awesome. So, you want to check in a week, or you want to hit it again this week? What do you think?
I'm gonna go to the gym tonight, and we'll see.
Okay. See how you do.
Yeah.
Don't do anything too heavy.
Yep.
Okay. Do your cobras before and after.
Yeah. So
Okay.
I mean, even if I'm going overhead with just a 45-pound bar,
Yeah,
you
give
okay
that-
with that?
I think that's a good place to start and see how you do, and then wait a day, see how your back responds.
Just
And then-
kettlebell swings, which puts
Okay.
a little.
Yeah, that's a little bit, but you're gonna do it, so I'm not gonna tell you not to.
I mean, as long as I'm not going heavy,
Yeah.
super high reps, just
Yeah,
see how
and
it
you know
feels.
the kettlebell swings aren't super compressive. I mean, you're working more than
More flexion extension.
Yeah, flexion extension. So just be careful going down. That's all I'm worried about is the flexion. So that's if you're going to injure something, it's going to be in flexion.
Cool.
So, okay.
All right.
Cool, man.
Thanks.
Take it easy. Don't forget your stuff.
Yeah.